Hello, my name is Allie KOEHLER, and I am a medical student at the University of Kansas School of Medicine. Today, I will be presenting on primary care referrals in a student-run free clinic. JayDoc is a student-run free clinic located in Kansas City, Kansas. The clinic provides medical and pharmaceutical services to underserved populations of the KC metro area. JayDoc sees over 1,000 patients a year for a multitude of chief concerns, but many patients have needs extending beyond the clinic. JayDoc utilizes volunteer community resource interns, which consist of 25 pre-medical students who commit to serve for 26 shifts over a 13-month term. The intern's role is to connect patients with medical and pharmaceutical resources outside the clinic with an emphasis on primary care. Access to primary care is critical for health trajectory and improving equitable distribution of health in populations. Many patients at JayDoc have not accessed medical care for years to decades prior to coming to clinic, so visiting with the community resource interns is a critical opportunity to address social determinants of health the individual may be faced with. Given no formal background in social work is required for acceptance to the community resource intern team, proper training for the intern team has been an area of emphasis. This study aimed to ascertain whether continued education sessions for the community resource interns impacted the rate of primary care referrals conducted. Moving on to methods. This quality improvement project integrates problem analysis and intervention design throughout the duration of the study. The initial community resources intern training focused on volunteer knowledge of primary care options for underserved communities. This included education on the services, pay structure, and demographic requirements for the major safety net clinics throughout the KC metro area. 5 weeks later, continued education session number 1 was held. This session focused on improving interactions with diverse patient populations, including providing gender-affirming care. After an additional 5 weeks, continued education session number 2 was held. This entailed training on utilizing an online, community-wide referral platform called IRIS. Qualitative feedback elicited from the interns was addressed at each continued education session. For the 4-month duration of the study, number of patients seen and number of primary care referrals made each clinic night by interns were recorded and analyzed using SPS statistical software. Results demonstrated a primary care referral rate of 53.7% for the 5 weeks following the initial training. Referral rate increased to 57.9% and ultimately 71.8% for the 5 weeks following the second and third continued education sessions, respectively. The increased rate was sustained for the remainder of the study. Throughout the duration of the study, a total of 308 referrals were made by the community resource interns to establish JayDoc patients with a primary care home. In conclusion, the study findings do suggest that continued education sessions for community resource interns increases primary care referrals made for patients. Increased knowledge of resources, comfortability with patient interactions, and use of an online referral platform are potential contributing components. Moving forward, we know that 308 referrals were made during the timeframe of the study, but tracking to see which of these referrals actually resulted in establishment of care would be an important next step. The utilization of IRIS, the online community referral platform, provides an opportunity to better track this, as the receiving clinic must update the patient status. Another consideration to inform future research could be to further assess the patient perspective on access to care. And ultimately, this study will serve to inform further training and continued education sessions for the community resource interns for the terms to come, so that JayDoc can ultimately improve patient outcomes and health equity. I appreciate you listening and thank you for your time today.